what we know is that these are changes to the indexation arrangements, that is how much more money is paid each year to the states for health and education. And previously, the previous federal government had a different measure of increase, and they called it an activity measure. So they basically paid the states based on the number of people who presented at the hospitals for delivering those services. The new measure is a CPI increase. Now, CPI, we know, doesn't cover medical inflation costs. Medical inflation runs at about 2.5 times normal inflation rates, and so that potentially leaves us with a shortfall, and that's why on budget night I said it was deeply disappointing to see that the Commonwealth had changed its funding methods and that they are an attack on the state's delivery of health and education services. The potential impacts for it could be, for example, you would have to wait longer to get treatment at a hospital because we wouldn't be able to have as many doctors or nurses on hand to be able to treat people. So it might mean longer waiting times for treatment when you turn up and present at a public hospital. In terms of some classrooms and so on, it might mean not as many teachers being able to be employed to teach the people that are the kids that are coming through school.
So bigger classrooms, for example.
That could lead to bigger classrooms, for example. So for those are the concerns that we have, and that's why the Premier, together with the New South Wales and Victorian Premiers, has called for urgent meetings with the federal government to be able to explain to them and take up the cudgels on behalf of Queensland for the funding to be kept in place, because obviously we've made commitments based around that funding promise. It's changed, and that makes it harder for us to keep those promises and deliver those commitments. But we're in Queensland, having taken some tough and strong measures 2 years ago, about 2 years ahead of where the federal government is, and we're on track to deliver a balanced budget. So, we are dealing with our problems. We think it's unjustified for the state, for the federal government to pass their problems down to us.